Clinical evaluation of headaches. The general physical examination for headaches should include vital signs, fundoscopic and cardiovascular assessment, and palpation of the head and face. The examination should include mental status, level of consciousness, cranial nerve testing, pupillary responses, motor strength testing, deep tendon reflexes, sensation, pathologic reflexes, cerebellar function and gait testing, and signs of meningeal irritation. Abnormalities related to the optic, oculomotor, trochlear, and abducens nerves must also be looked for. Mechanisms of production of headache include distension, traction, or dilatation of intracranial or extracranial arteries and veins. Intracranial masses cause headaches for the same reason. Compression, traction, or inflammation of cranial and spinal nerves. Spasm, inflammation, and trauma to cranial and cervical muscles. Meningeal irritation, and raised intracranial tension. Perturbation of serotonergic projections. The SNOOP-4 mnemonic may be used to recall red flags for serious secondary headaches. Primary headache disorders are identified by clues in the associated symptoms, such as cluster headaches present with ipsilateral lacrimation or nasal congestion. Migraine presence with aura, for example, scintillating scotoma, photophobia, phonophobia, and nausea. However, most patients with migraine do not have an associated aura. A life-threatening, secondary headache disorder may also be identified, based on the patient's description of symptoms such as diplopia, dimming of vision in a single eye, stiff neck, disorientation, rash, fever, eye pain, unilateral paresthesias, unilateral weakness, and balance change. Headache with signs of systemic illness, such as fever, stiff neck, rash, is seen in meningitis, encephalitis, Lyme disease, systemic infection, and collagen vascular disease. Focal neurologic signs, or symptoms of disease, other than typical aura, such as vision, speech, gait, and coordination disturbances, are seen with mass lesions, vascular malformations, stroke, and collagen vascular disease. Papilledema is seen with mass lesions, pseudotumor cerebri, and meningitis. Headache associated with vascular disorders comprise subarachnoid hemorrhage, acute ischemic cerebrovascular disorder, unruptured vascular malformation, arteritis, carotid or vertebral artery pain, venous thrombosis, and arterial hypertension. Headache may also be associated with metabolic abnormalities, such as hypoxia, hypercapnia, and hypoglycemia, and are seen in systemic hypertension, migraines, and metabolic syndrome. Headache or facial pain, associated with disorder of the cranium, neck, eyes, ears, nose, sinuses, teeth, mouth, or other facial or cranial structures. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.